Welcome back. We all have stress in our daily lives, which we often end up feeling in our bodies, even in our jaws. So, if you've experienced symptoms from soreness to inner ear pain and facial tenderness, you could have TMJ, a disorder many dentists say is on the rise during these turbulent times. Here to tell us more about TMJ and how to relieve some of the painful symptoms is Dr. Shannon Hobbs.
Thank you so much for having me.
Let's talk about this disorder because honestly, I had never heard about it before now, but I understand that a lot of people have varying degrees of TMJ. So let's just start with what causes this disorder and what it's all about.
So TMJ basically stands for temporomandibular junction or temporomandibular joint. And so the disorder is actually when that joint gets pretty inflamed. And so it's all the muscles around the joint that can start to swell up or become really tense or achy. And so it's really that pain that you start to feel in your ear and the muscles, headaches, things like that, that really qualify the disorder itself. Most of the time, people will experience the disorder from having clenching or grinding habits that happen to be subconscious. Generally, we're noticing that it could be genetic, it could be a bit of arthritis or even jaw injury from trauma in the past. And the biggest one, especially, is stress. We do notice that a lot of clenching and grinding is happening, especially because of the pandemic. And everyone's under so much stress these days that I notice it in everybody. Everyone is starting to get affected. So we have men, women, all ages, including children. I'm starting to see a lot of kids grinding in my practice as well.
How do we know the difference from just like a sore jaw from talking too much to full on TMJ? What are the main symptoms?
So it's really the severity of the symptoms that you're going to experience. So you're going to start to experience facial pain, really bad tenderness in the muscles, like severe aching. You might even have hypersensitivity in the teeth. You will have maybe a bit of clicking in the jaw, trouble opening your teeth, opening your mouth, pain when chewing. So you'll notice a lot of different symptoms that you might not necessarily get just from talking or your day-to-day activities.
I understand that people who suffer from this try not to open their mouths very much, especially when they're dealing with a lot of pain. So is that the best thing to do, or should you try to work through it to get the muscles going?
Yeah, no, it's definitely a good way to start. You don't want to exacerbate that kind of tension in the muscles, and you don't want to make the joint any more inflamed than it already is. Like any joint pain, whether it's your knee, your back, shoulder, ankle, rest is best. So anytime you're experiencing that kind of tightness, that soreness, you really want to relax the jaw. So I recommend to my patients like sticking to a soft diet so they don't have to open too wide. Careful when you're yawning. You don't want to cause that cartilage in the joint to slip because that could end up aggravating it even more and can lead to bigger damage down the road.
Can you sort of take us through, I guess, like Anatomy 101, how TMJ can cause that pain in the inner ear and even the sides of our faces? How does it get that far?
So you have like a large muscle right here called the masseter, and that extends from your cheekbone down to the lower part of your jaw. And that one's the big one for chewing. So when you're closing, you'll feel that clenching. When you clench your teeth together, you'll feel that muscle flex. You have another muscle that spans all across the head right here in kind of a shell shape. So that's the temporalis, and it can extend behind the ear as well. So that one fans the whole skull. Again, you'll feel it when you clench, huge muscle. And then you have tons of nerves bundled up from inside the ear that extend all across the face as well. So if you're starting to get that inner ear pain, you might even experience a bit of tinnitus, that ringing in your ear. You can get that joint pain as well, and it will just radiate. So you'll get all the pain in the muscles as well throughout the face and within the ear as well. So that's why it's the anatomy that's so complex.
I know a lot of people who do grind their teeth at night, and I imagine that exacerbates this. I don't do that myself, but I do like clench my teeth. I like a lot of people right now are, from 2020 to 2021 are doing a lot more, I think, teeth clenching out of stress. So what impact is that kind of an activity having on our dental health and overall health? And what can we do to stop doing it?
Definitely stress is a huge cause of grinding, and it's really, really hard to stop because it's so subconscious. And again, it would require eliminating the biggest stressors in your life, which is basically impossible, easier said than done. So clenching and grinding overall will end up reducing that enamel on the top surfaces of the teeth. So the biting surfaces, you'll start to notice a bit more sensitivity. You'll notice a little bit more pain when you're eating harder foods. Like it will press on the teeth and cause this flexion that will cause those kind of zings in the teeth. You can get increased recession. So that means the gums will drop down a little bit, exposing the root of the tooth, which can be pretty sensitive to temperature and to brushing. grinding. Definitely, of course, there's that typical headaches, jaw pain, neck pain, all that fun stuff that come with TMJ or TMJ disorder. I have noticed, especially with COVID, 2020 was a huge year for patients cracking their molars, fillings breaking off, teeth breaking all together, like literally patients coming in with crowns in their hand. And I'm like, oh my God, what's happening?
One of the preventative measures to help, sort of save teeth are night guards to guard against that actual grinding. And a lot of people use them, including the person who sleeps beside me every night. And it breaks my heart to wake up and hear him. Like I can hear him just going at it in his sleep. Is it the best safeguard, or is it the best option?
I mean, it's up there, definitely. I really like night guards. I make them for my patients because it is a great way to prevent that dental trauma, all that damage that can happen to the teeth from clenching and grinding, especially at night because it's so subconscious. You don't even know you're doing it. I like to make more rubbery kind of night guards, kind of like a sports guard material that's a little bit smaller and thinner, because I find sometimes it actually causes the teeth to bounce off of it. So it doesn't allow you to actually squeeze into it, and it really relaxes those muscles, really relaxes the joint. There are alternatives to night guards. There's Botox that can be therapeutically applied to the muscle groups themselves. So those big muscles that I showed you, you inject the Botox there. It will help reduce the ability for the muscle to squeeze as hard. Super effective. I love the results that we get. It's just that it's expensive because you have to redo it a lot, especially if you're a heavy clencher grinder, you need a lot of Botox to calm it down.
Is there anything we can do at home to help ease the pain?
You can always take an anti-inflammatory, kind of like ibuprofen, which will help kind of calm down that inflammation of both the muscles and the joint. You can also take a muscle relaxant, which can also relax those muscles. If the ibuprofen isn't doing the trick right before you go to sleep, it will really help just calm those muscles down and reduce those flare-ups much more effectively. And then you also have my favorite one, which is massage. So the massage technique is amazing to help relieve that pain right away. So it's the same as like when you get a bit of a muscle spasm, or, your shoulder's aching, your neck is tight or whatever, just kind of like getting that blood flowing. It can help a ton to relieve that discomfort. What I like to do is I take my knuckles, like my two knuckles, index finger and middle finger, and I place them right where kind of towards the ear, right where my cheekbone is. And I kind of go down a little bit and I keep my mouth a little bit open. And you can kind of feel those knots in there. And I just do these small circles. You're looking for your cheekbones, all along your cheekbones, and then it kind of comes in a diagonal down your jaw. So there. And so I place my knuckles just there.
Oh, okay, yeah.
You can really feel the knots that get in there. So I like to either apply just some finger pressure or the knuckle pressure, which can help a lot. And then also if you're suffering with the headaches, or you're finding that a lot of the clenching muscles up in the skull, the temporalis muscle is a little bit tender, you can feel those points when you're pressing with the finger pads all along that muscle there. And you can even tell if you're clenching or not, because when you clench your teeth really hard, you'll feel it flex. And you can go behind the ear too. And then there's my favorite one, which usually I recommend to have your dentist do it, or even your massage therapist can do it. I think they kind of stopped doing it during COVID just because of infection prevention and all that, because you do have to put a finger in your mouth, which isn't super cute. So make sure that your hands are clean, your nails are trimmed, because you have to go a little bit far back. So basically you can do this either with your thumb or your index finger. I like to do it with my index finger, but the easiest way to do it at home is with your thumb, and you're basically going to fish hook it in your cheek, kind of like this.
Are you squeezing? Are you just kind of squeezing on the outside and on the inside at the same time?
Yeah, okay. I'm squeezing both, and you're going to feel a spot. So if you are suffering and you do have a bit more discomfort, you're going to know you're going to feel the sore spot, and you kind of need to poke the bruise a little bit to get the blood flowing in there. So it's the same as when you have a knot in your shoulder.
Back. Yeah.
Exactly. Yeah. So you kind of just gotta work it a little bit, and it's the same thing. So those muscle groups, these ones are the most impacted for sure. It's very rare that I have some, but it's usually, you'll notice it if you're having a hard time opening your mouth. It's that muscle that's spasming, the one in your mouth. So that's the one you got to go and work a little bit.
Thanks so much for this helpful information, Dr. Shannon. Really interesting.
Thanks so much for having me.
Don't go anywhere. We'll be right back.